Now it's time for the magnificent again. Please welcome the very last, but certainly not least, of the magnificent for a high-speed Q&A moderated by Mark and Rob. Over to you.
Last one.
Don't worry, it's the last one. Right? And I know my place if I'm between some good content and a good beer, right?
Here we go.
Yep. So the last one, ladies and gentlemen, I would like to welcome Raimo van der Klein from Incision. Raimo.
Hello.
So you see he's a typical CEO, because that's your clothing for the next couple of years, right? Learn to it. So Raimo, what is Incision?
Incision, yes, it's a company around 7-8 years old. We started as an e-learning platform for people in the OR, so especially surgeons or students that want to become doctors. We have an academy environment where they can learn about procedures and do them well. It was originated by medical staff, ex-surgeons, you could say, that really saw that there is a gap between theory and practice when residents enter the hospital. And they've developed a platform. And the last 2 years, we have extended our identity or our role, in a sense, to also deliver performance support to the OR staff. That means we help them also on the job, not only off the job with learning, but also on the job with information, services in an app.
Right. So why the app? Why did he ask for it?
Yeah, well, the thing is, in an e-learning environment, you can do that very well in a web environment. But if you really want to do performance support in the OR, on the floor, you need to be actionable. They need to quickly be able to request services or find information. And so the app was, for us, a no-brainer to start. And it's also an excellent way to build a relationship with the people in the OR.
Right.
Cool. Can you describe a little bit? This is built in an incremental way in an OR room that is heavily regulated.
Yes, so that was, of course, a big challenge for us. Also there, an e-learning platform, you don't touch any infrastructure of a hospital, of course. But the moment you do performance support, you must become a part of the way of working in a hospital. So that was for us also the challenge, our last 2 years, to as quickly as possible have one hospital start using us. And we were capable to do that within 6 months of development. So, and that gave us a learning opportunity. So as we had our first hospital live on our platform, it's called Assist, we started learning a lot and integrating those services in the app. And it's also a challenge that, of course, it's normally hospitals buy enterprise-grade software. And we are kind of you could say, a scale-up, 70, 80 people. So that was quite a challenge to convince them, of course, but with our reputation, which we built up in the academy part of the business, we were able to secure a couple of pilot customers, and that really helped us ramp up the whole product.
So in this very rapid interaction, how do you then decide which of all of the demands are actually the most valuable to build in?
Of all the?
All the demands you get, so of all the features that people could choose. What is the most valuable and how do you do that?
Yeah, so prioritization, you could say, of our backlog. Yeah, of course, it's always a challenge. Short-term feedback, bugs, or customer feedback. You need to keep the pilot customer happy, of course, but also next to that, you need to be able to scale. We have ambition to go. Well, we are entering the US market currently. The first hospitals in the US are starting to use our product, so that's also very cool. But prioritization keeps being a challenge, where you weigh off all these different things, and I think there's no one formula for it. We decided not to make a very formal process in that sense, and keep it very tangible or actionable or ad hoc, you could say. Whenever something pops up, team gets together to quickly address it and to prioritize. I think it's also one of the philosophies we have, is that a lot of the responsibility we've put in the product team to figure out and give them the strategic guidelines to make the decisions themselves.
So why was Levy9 the designated partner already from the starting point, the development process?
Yeah, so Levy9 was the partner that was chosen before I came to Incision to start working there on the academy part. The platform was kind of crashing, so we needed somebody to help us create speed and create a scalable platform again. So they've built that. And the moment we kind of decided to extend, you could say, our impact in the surgical domain, we started talking to Levi9 and discussing what the best setup would be for us to come in an opportunity to learn quickly, because I think that was the key. And also to create a team that's capable to scale quickly from an MVP to a product that's product market fit, and then also go to enterprise level. And I thought we could have decided maybe to source in, find our own developers, but I think that would not have been, we would not have been able to reach the speed we have created currently. Just to give you a little bit of context, is the moment we started development, 6 months later, the first hospital started using the product. So from nothing to, and then 6 months later, the first product. And within a year now, we are entering the US market, which is of course, very compliance is a big issue there. So also there, we're making really those steps to enterprise product. And we could not have done that, I think, with an in-house team that needed to learn so much about building a scalable and secure tech stack.
So you're hinting on Raimo, but you're going so fast in multiple markets with a team that can do features super quick. How do you keep your tech stack modularity pristine?
AWS. So AWS is, of course, a great platform that really created speed for us. Also, the academy was already kind of built modular in a sense, so we could reuse elements like user management, the content management part of it, the registration processes, etc. So that really helped us also to speed things up. Of course, next to that, we have a local solution architect here in the Netherlands, but also Levi9 provided an architect that really helped us to prepare for the next phase where we really need to become enterprise-grade software.
Great. So in the final seconds, what is next? Are you going to be registered medical device, or where will you go?
We hope that will kind of that we don't need to do that, but integrating more with the hospital systems would be great, especially in the Netherlands. It's always a challenge with we know the big company in the Netherlands that's kind of owning all the data. So that's a little bit of a challenge in the Netherlands, but in the UK, or in the US, in the UK, we're definitely entering that market, and let's conquer the world.
Ladies and gentlemen, Raimo van der Klein.
Thank you.
Thank you.
Let's go.
Thanks.